As a percentage, presbyopes are a group of patients where refractive correction is required by almost all in the category. Yet only a small percentage of these individuals are wearing contact lenses. We've found that most contemporary multifocal lens designs provide opportunities presbyopes to wear contact lenses again. And although the ocular surface needs to be respected in these individuals and appropriately cared for to optimize lens wear, we found 3 things that help when fitting presbyopes with multifocal contact lenses. The first is making sure that we discuss multifocal contact lenses with every presbyope that's a candidate. Interestingly, as a profession, we only have a discussion about contact lenses with our presbyopic patients about 9% of the time. And when we do, only about 15% of the time do we present them enthusiastically. Interestingly, when presbyopic patients between the ages of 40 and 54 were asked whether they wanted to try contact lenses, 42% said they would be interested. We need to make sure to discuss the opportunity to wear multifocal lenses with all potential candidates. Next, we need to make sure that we're utilizing the fitting guide specific for the lens we're fitting. Each contact lens design has nuances that are critical to that specific lens, so it's important to follow the fitting guide with every fit. What's also critical is that if you have a current multifocal contact lens wearer that you're transitioning from one design to another, be cautious not to simply transfer those powers into the new lens design. Make certain to follow the fitting guide for that specific design based on the manufacturer's recommendation. The third involves challenging the traditional order in which we typically measure vision. Normally what we do is we'll place lenses on patient's eyes, wait a given period of time for them to settle, and then assess distance visual acuity first, and then near visual acuity second. When it comes to the presbyope, we may want to reconsider the order in which we do this. A presbyope's chief complaint is typically the inability to see at near. Knowing this, we challenge the traditional order of vision measurements and would want you to consider having them look at near targets prior to the distance vision measurements. The logic for this is to provide the patient the win with multifocal contact lenses first, which is the ability to see the near targets without the need for glasses. Then, after success is demonstrated, measure distance visual acuity binocularly. In our experience, this has allowed patients the opportunity to more easily appreciate the benefits of the lenses during the fitting process. Remember to discuss multifocal contact lenses with all patients that are candidates for them. Make certain to use the fitting guides appropriate for the lens design and style you're fitting. And also consider showing patients the win with multifocal lenses by demonstrating success at near with the lenses prior to assessing distance vision. Keeping these things in mind will help us appropriately care for our patients, which is ultimately why we do what we do.